I can't tell you how positive the energy has been and how satisfying it has been to see people's eyes lit up, bushy tails, and engaged. And we did all this as an effort to assist the Office of the Assistant Secretary for Preparedness and Response in how they can predict, prevent, and respond effectively to shortages that occur within the disasters, bearing in mind that there's a background chronic disease. Bob Kadlec, my brother in many ways, my former business partner, the guy who always covered my backside with the White House back in the day, and the man who gave us the idea of the Assistant Secretary for Preparedness and Response is here to talk to us a little bit today. Bob's career is pretty illustrious. I won't go through it all. Air Force guy, another Air Force guy. You wonder which golf course was Bob deployed to? He was an Air Force guy, but 20 years in uniform, trained at the Air Force Academy, trained at USIS, spent a significant part of his career with the SOF community and other important three-lettered activities, and has been a significant player in policy development and policy implementation, particularly originally in the area of biodefense. And he carries that light stronger than any other advocate at this point in this country. Bob will tell you the job that he has is never ending, and it's always busy. And we're fortunate, I think, that he's got a few minutes to visit with us. So Bob, why don't you come share your views?
I always remind people who clap for me before I say anything. I said, I haven't said anything and it may not be worth clapping for. But anyway, first of all, Craig, I just want to say thank you very much for that kind introduction. I have the privilege of following Craig a lot in my life, and he's highlighted a couple of those instances, but he was the first ASPR that we had, and again, someone who has kind of walked in my shoes, so he knows what that's all about. But I want to thank, first of all, not only Craig for being the person who led this effort, which in some of the conversations I've had outside, it seems like a very productive conversation. And I've asked Craig with the Academy to come out and visit with me when the proceedings are done so that I can sit down and take a longer listen and look to what has been covered these last 2 days. And I'm sorry I just couldn't be here for the last two. But the thing is I also want to let you know that I think one of the things that you probably want to know is what is the ASPR doing about this? And so in some ways, I just want to convey 2 or 3 things that would make it abundantly clear that, number one, is I don't understand the problem fully, but I understand the consequences of the problem. When we put patients' lives at risk because they can't get their fill in the blank, whether it's the having availability of an EpiPen, or if it's having availability of a particular drug, generic or not, whether you have the availability of saline solution or not, those are all things that matter to us in a very significant way. Craig shared with me a wonderful kind of analogy as it relates to this problem and just the issue of chronic disease. And that's the notion that people with chronic diseases, bump along, and we provide the best care and service to them as physicians and nurses and physician assistants. And then if there's a disaster, boy oh boy, there's the risk of exacerbation. Why? Because of conditions that may be ambient, the fact that they may not be able to take their drugs, or some other mitigating factor. And that's really about what our supply chain is around many drugs that are vital every day for people's lives. And that only just gets worse in a disaster. I witnessed it firsthand in Puerto Rico. Why? Because, well, there were some critical drugs that were being manufactured there. Saline solution, IV bags for administration of drugs and chemotherapeutics, pediatric chemotherapeutics. But that was one part of the problem, and that became a global problem because it not only was a problem of getting the material out of Puerto Rico, but the fact is that was a principal supplier to the United States. And so it became the FDA's responsibility to expedite reviews and clearances and approvals for products that were brought from overseas to fill in that gap. It was also a problem, if you want, geographically in Puerto Rico, because there were people basically who were isolated without communications, without access to clean water supply chains, and they were at risk, particularly people like who were diabetics, that we had to come in and be the Johnny on the spot for, to figure out how we could get supplies of those vital drugs into those areas that were inaccessible other than by means like helicopter or four-wheel amphibious vehicles. So it's important to know that it's a real deal. It's happening every day. The second thing is really have to figure out the strategy, and I hope that they'll be coming out of this conversation, how we're going to prevent and mitigate these things in the future. But I can tell you one thing, if you're looking at the U.S. government to fix the problem, ruh-roh, I think the thing is what the government may be very good at doing is providing maybe opportunities to partner and bringing partnerships together. I have a few examples of what ASPR HHS does on a small scale, but I think on the bigger scale is what we need to do. And again, through the FDA, task force has been set up, and you've heard from Laura Wolf from our critical infrastructure group in ASPR that we have a role to play in that. Obviously, it's a limited role in the sense of what is day-to-day, but the critical word here is anticipation. How do we anticipate these events? Some of it is just based on the idea that, yes, there may be risks that happen as a result of events like hurricanes or cyclones, but also understand that this is an international issue of supply chain, right? These the precursors, the products that we need, or the precursors for some of these products that we need are not here in the United States but somewhere else. And they're subject to things that may end up to be beyond our control. So the question is how do we deal with that problem? And again, I believe that the critical thing here is the partnerships piece of this, which are multi-sectorial as well as simply just with the pharmaceutical industry. And obviously, not only is there a need for this kind of communication that has to happen, but it's this conversation, ongoing dialogue that has to happen, because in some ways we need to develop that situational awareness of those supply chains and really understand where those things come from, how did they get here, who makes them, how they're made, how they're shipped, to really understand how to do this and really identify the root causes of what is an area that, quite frankly, is getting more attention broadly, because whether it's medicines or other vital things in our society, we're beginning to appreciate that much of this stuff ain't made in the US of A. And much of this stuff is dependent on outside sources for precursors, even for products that are made in the United States. And so there's a lot of opportunity, and one of the areas that I'm kind of focusing on in my role, there are a couple, but one is the issue of what BARDA can do for this problem, because I think BARDA can, with new authorities in the 21st Century Cures Act, can actually address some of these things through innovation, and I'll talk a little bit about that. You heard about what Laura Wolf does in terms of monitoring the situation and being able to work with FDA on a daily basis, real-time basis, obviously surge during events, to basically make sure that we have visibility working with the industry partners and the supply chain managers and distributors to basically understand what those situations to deal with spot shortages. And then, little or not, you would probably not believe this, but the Hospital Preparedness Program, as it's kind of evolving into looking at hospital coalitions, which includes the role of the pharmaceutical suppliers in that coalition to be part of the solution set. And again, critical thing is situational awareness, which involves communication, prior event pre-planning, and anticipation for those events. So let me get to the nub of what I think is what we think are some real interesting possibilities. One thing you probably may or may not know about is that the Strategic National Stockpile will be under ASPR's responsibility starting 1 October. That doesn't mean anything is moving. It just means the guy who was up here before, Greg Burrell, gets to call somebody else than the person he used to call at CDC. And the intent is that we're going to have a very close, productive working relationship to do a couple things. One is to rationalize what we have in the Strategic National Stockpile. And you may say, well, what does that have to do with shortages of drugs? Well, we have a lot of stuff, $7 billion of stuff. And right now we're undervalued in terms of under-resourced in some of that stuff to meet our requirements. And so part of this is really going to have to relook at how we're going to have to not only develop and procure products, but how do we sustain that product over time, which has a lot to do with the manufacturers and the supply chain and what's in the market. Because as we've done with some products, we've identified some products for some of the anti-radiation countermeasures to basically have a bubble in the commercial market that we can pull from in addition to things that we have on hand. And so that's maybe one strategy we could look at. Does the Strategic National Stockpile offer some models that would be useful to think about some of these things? The Strategic National Stockpile can't answer these problems, but they may provide some very useful and value-added kind of approaches that we can adapt. The other thing is I'm looking at an issue internally to ASPR, which is along with the SNS, which is the last mile, which is about how do we get products to the people who need them when they need them, and realize that in some ways what we've constructed historically with a points of distribution may not be the best way. There's some really innovative ideas out there. You know, I'm not talking about Amazon, you know, 4-propeller robot, you know, UAVs or anything at this point, but I'm suggesting there's a lot of supply chains that we can tap into that could get us in a better position. But that doesn't necessarily address the problem of how do we make sure we have a product sufficient in sufficient quantities, and you know, getting them to some place where you need them is one thing. That's a transportation issue. But how do you really get to that other problem? Well, two areas that what we're trying to do is, one is innovation. For those who haven't looked at the 21st Century Cures Act, there's a provision in there that is directed at BARDA, which is the Medical Countermeasure Innovation Partnership. We've kind of labeled that or branded that DRIVE, the Directorate of Research, Innovation, and Ventures, with the intent to basically use a more commercial-related approach, something like you would have with a VC. I think a good model for those who are not familiar with it, but I am because of my time on the Senate Intelligence Committee, is InQtel. Here you have a nonprofit entity that basically acts as a venture capital for the CIA to basically help develop new technologies that keep us on the cutting edge of information. Can we do the same thing for biotechnology and pharmaceuticals? We think so. Last week I was up in New England and actually visited a couple of places that we think are very interesting because they offer some interesting opportunities for innovation as it relates to some of these problems. How can we fix the IV drug solution problem? Can we do something different? Can we do something innovative? A distributed approach. And that's just an example of one. Next week, coincidentally, again as part of the DRIVE initiative, we're looking at the opportunity of doing a Priority Medicines on Demand summit, which will be hosted by DRIVE, BARDA DRIVE, with the intent to basically say, can we do things that can provide on-demand pharmaceutical production? There are examples of that. There are capabilities of that. And the question is, you can imagine that there's a lot of pushback to maybe commercialize those because of the virtue of maybe other equities or interests by some industry partners. But we're finding that some industry partners are interested to join with us to look at these technologies because they would revolutionize how we would deliver, and when I say deliver, not administer, deliver products to patients, and particularly in a pinch if we had to do that. So we're looking at a variety of different things in a variety of different ways. We don't own this problem, but we certainly have a vested interest to find practical solutions, real solutions, near-time solutions to address this problem. Because in every disaster, we run into it. We run into these same situations over and over again. Sometimes it's because the disaster happens where vital drugs are being made, big problem. But more likely and more common is the circumstance disasters happen and the people who need those drugs or products can't get them for one reason or the other. And that's a function of my responsibilities to ensure that we do that. I will close with just one observation, and it's just saying why the value of having partnerships. It was just something that was on NPR, and that was just today, I guess it was. The 6th of September is today, right? I live in dog years, so I'm sorry if I don't know what today is. You know, when you're not the lead dog, the view doesn't change. And so day to day, I'm just trying to drive on, mushing on. But it was really the fact that there is a consortium of companies that created a nonprofit to basically try to, a nonprofit company to make drugs that are in short supplies. And I'm sure that was a conversation piece here. But I think it's those kind of things that we need to really kind of develop and look at and realize there's not going to be one silver bullet solution to this, because there's never an easy fix to any complicated problem. You know that, I know that. But I do think it's going to be a portfolio of approaches, portfolio solution sets that get us closer to the point where we can have great confidence that regardless on blue sky days or the worst so stormy days, that we can have an uninterrupted supply chain of products, life-saving products, and get them to the people who need them. So with that, I'll just leave you with the intent that I'm committed to hear more about what was discussed these last couple of days. I'm committed to do my part in working with FDA, with Scott Gottlieb, to figure out the solution sets. We're going to come up with some, we hope, that will be helpful in contributing. It won't be the panacea, but I think the whole notion is it's going to take all of us working together to work to figure out the solution set that's going to get this problem fixed. So with that, I'll stop and take some questions if you have time. Thank you. I was looking at Greg Burrell. You want to ask a question? Jesus! Man, that was going to be, now I was going to start to sweat. This company's got to have a question. Any questions for the I appreciate, first of all, I appreciate your commitment and time and effort in doing this, because I've had the privilege in the past to serve in the Preparedness Forum, and what a great honor that was, and boy, I learned so much. It was amazing. And the benefit of that is I got to meet a lot of great people and create a lot of great relationships that have endured over the years. And I know that the ones that were created here hopefully will endure as well. And we'll figure out some solutions to this. Do I have a taker? I have a taker. Is there somebody? Really? If there are no questions, I'm going to have to get back to the dog sled. I got to start mushing again, but I really appreciate your time, your consideration, and your attention. And like I said, I look forward to hearing about your product. So listen, best of luck, safe travels home, and we'll see you around the neighborhood.